Hey influencers, welcome back. If this is your first time seeing me, please do subscribe, join the family, help me grow my channel. In today's video, I'm going to be discussing things that I think the COVID-19 disease pandemic has had an impact on in the HIM arena, HIM industry, all things HIM. I do have a notepad here that I'm going to be using to stay on track. Make sure that you stay tuned and let's get started. The first one is education. Education is extremely important. We always want to stay educated, stay informed, know what is trending. And right now with the COVID pandemic, a lot of people around the world has been impacted. So this has granted a lot of students, healthcare professionals to be able to go back to school, re-educate themselves, and it's also given people an opportunity to rethink your career. We know that right now a lot of people in the world has been impacted. People are getting sick, people need care. So re-educating yourself to be able to go out and support is extremely important. I do think education has been something in the HIM industry that is now booming the way it needs to. It is something that a lot of people are jumping into because they know with healthcare, there is my second topic, which is job security. And job security is important. We want to be able to find jobs. You don't want to educate yourself, get all that education, degrees, certification, and not be able to find work. I do think job security is something that has been impacted on. We're able to find jobs, retain those jobs. There are lots of patients that needs care, whether it is on the front line, front end, or on the back end, where you're dealing with the system, the patient's documentation. So that second point of job security is another impact that I feel is great because people are able to know that in the HIM industry, you will have job security because that care is needed, that patient care is needed. So the third one I have on my list is the remote telework. Remote telework is extremely important. A lot of people like to work from home. Some people don't want to have to deal with going into the buildings. And also it keeps people safe. It keeps people from getting any type of disease because somebody else may have it. You don't know who have it. A lot of the office buildings, if you look at that, they don't have open windows just for safety purposes. So with remote teleworking, you're able to stay home and still get your job done. So I do think with COVID, it has granted a lot of companies, a lot of management, a lot of leadership, a lot of organization, the ability to test out if we can truly work from home, which has been the case. So that's a plus. The next one would be privacy and security. With COVID going on, people are being vaccinated, people are choosing not to get vaccinated, and people are registering to get their vaccination. And you want to make sure that you're keeping that information private, you're keeping that information where it needs to be. As healthcare workers, we always want to practice privacy. Protected health information, PHI, should most definitely not be shared. You can't disclose information when you're not supposed to make sure that those things are being done. You want to be sure that you're practicing those rules, you're following those guidelines. Next one is EHR. That is the electronic health record in healthcare industries, organization, hospitals have had an impact as well. We're building systems to be able to hold the capacity of people getting sick, people getting treatment, people that have to see their providers. It's extremely important. There's also work queues that needs to be built to make sure that it holds the information that we need to for the patient, such as people who want to get vaccinated. So with the EHR, there are different things that are being developed and we're learning as we deal with this monster of a disease. The next one is coding. Coding has been impacted because this is something we have never seen in our country, and this is something that we're going to be coding. You have to make sure when a patient is diagnosed with this particular disease, we're able to code it, or the different type of elements when it comes to what does this patient truly have. The next one is the HIE, and that is Health Information Exchange. That has had a tremendous impact. This is because from providers to different healthcare organizations to different hospitals being able to communicate with themselves, we have to make sure that information is able to be shared. In order for patient to get care or continued care, you have to be able to share that information. So the HIE system has been impacted. We want to make sure that the information that is being shared is accurate and is also private. We don't want to disclose information to other hospital, incorrect providers, and things like that. So that has had a tremendous impact. The next one is the HIM department structure. And this is because we're used to coming on site, working with people. You're working in cubes. You have people next door to you. You can actually walk around freely, no mask, all of that. Now with what's going on in the country, we're trying to downsize, make sure, is this needed? Is it not? You're wearing those masks. And then patients were able to come in, pick up records, and it's a little bit different now. So the HIM department itself, the physical building itself, has to restructure how to make sure that we're able to cater to patients' need and still keep the team, the staff, the managers, everyone safe. So these are some things that I think have had an impact based on what's going on in the country with the pandemic. Let me know down below what you think some other impacts that has happened based on COVID. I would appreciate your comments. I know there are lots of different things we know that COVID has done to our HIM industry. Comment down below. Let me know if there's anything I missed. And then let me know if you want to see more topics like this. I hope you guys enjoyed this video. I hope you found it to be valuable, helpful. I do plan to do a little bit more detailed video on some of these contents, especially when it's dealing with what's going on in our country. It's important we stay informed, and I will see you on the next one. Bye, guys.